Hi, so I'm here with Betsy Ladyzhets, and she is the co-editor with Miles Griffiths of the new online publication, The Sick Times, which is all about long COVID and related complex chronic conditions, post-infectious or post-acute infection syndromes. But anyway, so I'm a fan of their publication, and Betsy recently wrote a piece, or this week, I guess, or
Yeah,
maybe
this week.
this week. Yeah, I wrote a piece basically about federal grants to 9 long COVID clinics of $1 million each. Well, whatever, you can explain what the details are. $1 million per year each for 5 years, perhaps. And for a total of 45 million, I guess, if it all works out. And so she sort of talked to them each about what they were planning to do with it, the funding, and so I thought it was a good overview of one area that I haven't really looked into that much. So Betsy, why don't you tell us what the context is and what you found out?
Yeah, so this is a program from the Department of Health and Human Services, HHS, and it's run through the Agency for Healthcare Research and Quality, AHRQ. So a lot of acronyms, but basically the gist
I
is
always
the
can't
federal
remember if it's
government.
AHQR or AHRQ, but it's
It's
AHRQ. It's at the
AHRQ.
end. The Q
Yeah,
is at the end. Okay.
yeah, Healthcare Research and Quality.
Okay.
Yeah, so they have this $45 million pot of money, and they're distributing it among 9 clinics that each would get $1 million a year for up to 5 years. It's not like 100% guaranteed. The clinics have to basically submit progress reports and kind of tell the federal government how they're doing in order to get the renewals. But that's essentially what's been allocated.
These are
And
existing,
the
these are existing long COVID clinics, right? There's not money to set up.
Yes.
These are existing, functioning long COVID clinics.
Most of them
Most-
are. So there is one that's sort of a new program at Mount Sinai that's kind of an offshoot of their existing clinics. And there's another one of the ones that unfortunately didn't get back to me for an interview at Emory University that seems to be new. There's not a lot of public,
But you broke up for a
but
second there. You broke up for a second there. What was that university? That was which one?
Emory University.
Emory. Okay, in Atlanta.
Yeah. Um, they were one of the ones that didn't get back to me, so not as many details. But the majority are existing clinics that are multidisciplinary, which essentially means they have many specialists from different disciplines of medicine all working together to care for people with long COVID. And this is a model that seems to be more helpful than other kinds of clinics out there that might be just like physical therapy or just one or two other types of medicine. So that was kind of an important distinction for this program. You know, AHRQ specifically was looking for these multifaceted clinics and those that have, you know, existing track records of caring for people with long COVID. And also the clinics all had to come up with proposals for how they're going to like disseminate education and, you know, improve access to care. So
So
it's not just the clinics themselves, but like broader community outreach.
so basically, they had to put out a request. So basically, the clinics applied for the funding, or
Yeah.
okay. And how many, even, I mean, you sort of know the somewhat more the landscape of long COVID clinics. How many long COVID clinics are there even in the country that do we think, or things that bill themselves?
Yeah, no, it was a good question that's sort of harder to answer than you might think. I would say probably a couple hundred. I actually did a story last year for Science News where I attempted to compile a list, which was probably not exhaustive, but was as comprehensive as it could be based on lists from patient advocacy groups that try to keep track of this sort of thing. And also just kind of doing some searching of websites, looking at the sites affiliated with Recover, and which also tapped into kind of existing long COVID clinics
Mhm.
and other things of that nature. I don't remember the number off the top of my head, but I can send you the link to that piece so you can
So
include it.
it was a lot. It was a lot more than 9.
Yes, it was a lot more than 9. But you know, many of those clinics that I wrote about in that story were not of this multidisciplinary model. A lot of them are like physical therapy
I see.
focused, which is not necessarily helpful if you like have post exertional malaise or you have an ME type manifestation of long COVID.
So is so I guess,
etc.
since we don't really know what long COVID is exactly, like what is it that they're doing? Does that mean that they're focusing on symptomatic relief in each of the different domains? I mean, they can't cure long COVID at this point.
Yeah, symptomatic relief, I think, is generally the focus. There's also a lot of interest in, doing kind of testing, trying to figure out if people might have other diagnoses that maybe have associated treatments or at least associated symptom management strategies. Like it seems relatively common, at least among multidisciplinary clinics, to be looking for like dysautonomia or ME. In some cases, maybe more specialized like mast cell activation syndrome and some of these other post acute chronic diseases that
So,
can be co-diagnosed, and then like treatments associated with that. So like if somebody has POTS, then there are treatments if
so,
somebody
so, so
has
is
XYZ.
screening for orthostatic intolerance or for autonomic dysfunction or for POTS specifically is generally part of the workup, and screening for post-exertional malaise, or at least focusing in on that as a potential symptom, I assume is that generally part of the workup at these places?
Well, it depends a lot on the clinic, honestly, at least for the ones that
The
receive
ones
these
in this,
grants.
the ones in
Many
this
of them are
grant
doing this
proposal.
because they're, yeah,
I mean, we're
yeah,
talking about the
yeah,
ones that focus in this grant proposal as opposed to
yes,
the
for the
hundred.
ones in the grant proposal, yeah, many of them are doing that, yeah. Although, as with anything, there's sort of a varying levels of education and kind of keeping up with research on long COVID. Um,
I guess
yeah, so
did the agency sort of have any requirements, for example, that they not be ones that are offering, cognitive behavior therapy and graded exercise therapy as curative therapies and that kind of way? Was there any kind of awareness in making the from the agency of what they didn't want happening, as opposed to the kinds of things that they did want happening?
that's a good question. And I'm not sure off the top of my head. I will say the solicitation for the grant like applications is public and it's linked in my article. So you can take a look at that for
But
the
okay,
more granular
so
details.
and do you know if they uh, I mean, I guess it's curious because they've been involved in some previous looking at some of the research the agency has,
Yeah.
and had issued then a finding that if you take out uh, the studies that I forget all the details, but basically they found minimal, evidence for the treatments, and especially once they segmented out some of the studies that were less robust, they found, really no evidence much for the treatments. Um, but I guess I'm wondering if this grant exhibited some awareness of that, their own findings in previous sort of iterations.
Yeah, no, I'm not sure specifically, although I will say that when I asked AHRQ about, their process and particularly how they were consulting the patient community, they mentioned that this program was informed by an event that was like a symposium on care for long COVID that happened at
Hold
the
on, that's
beginning
the
of the
phone ringing
year.
in my mom's apartment here. So hold on just a second while that uh my mom picks up the phone. Okay, she's picked up the phone. Okay, now you can continue. Sorry
Yeah.
about that.
Yeah, so there was an event that happened at the beginning of 2023 that was, I believe, co-hosted by AHRQ and Senator Tim Kaine's office that specifically discussed issues of long COVID care, and had, patients and clinicians speaking. And so they mentioned that as, something that was informative for this grant and other research that the agency has been doing. This is also tied into the broader Office of Long COVID Research.
Right.
Um, that was announced a few months ago.
So when do these grants become effective? When do they start getting the money, or is it already
They
being done?
started getting it in September.
Oh, just
So
okay.
it's, yeah. So it started a couple months ago and is in kind of early stages.
And so what's your plan in terms of following up after this?
Um, yeah, definitely want to keep in touch with, researchers, clinicians at these clinics and, check in with them on how they're doing. Another big piece of this grant is collaboration between the different sites. So they're going to be having meetings, both both remotely and I believe in person once a year, was what was mentioned to me. And that's going to be helpful for developing like shared best practices and hopefully informing guidance policy for HHS, just about how to care for people with long COVID.
And is there none of the money is specifically for research, or some of it, or they're going to be doing, and presumably they'll be collecting their data, but they won't,
Yeah, they're collecting data.
but it's not formally research funding.
Yes, it's not research in as much as they're not looking at like biological mechanisms of long COVID. They're not doing clinical trials. They're not necessarily like collecting samples of patients. But there is a research element in the sense that they'll be collecting data and looking to see what works well for caring for people. One clinic in particular, which is at the Kennedy Krieger Institute, and it was the one pediatric long COVID clinic that was included in this grant. The PI there who I spoke to mentioned
that's affiliated with Hopkins in Baltimore, right? I think we get it right.
in
Okay.
Baltimore. Yeah, and the PI there mentioned a specific research angle on looking to see what accommodations are helpful for kids with long COVID in school settings. And so I guess their kind of research questions are like, what accommodations are helpful for students? And then what are some barriers for kids receiving those accommodations that maybe could be addressed by, government guidance? So there, I think, are a few other kind of cases like that. Well, they'll be looking at specific questions around care access.
Okay, so basically some of that part is sort of policy oriented to a degree. What can we do to sort of facilitate all this?
Yes. Also, several of the clinics are working with a program called ECHO, which is a model, I believe, set up by the federal government and that has been pioneered by like different universities, generally public universities, in which physicians or researchers from like specialized clinics at, like generally research hospitals, provide education and mentorship and training to primary care doctors in less well-resourced clinics. And so this is kind of an established model for other specialty areas like other chronic conditions. And they're now using it for long COVID. And so, several of the clinics are kind of using this model to, I guess, teach primary care providers in their surrounding areas about long COVID.
And so
that's another thing they're
doing. For these kinds of clinics that are specialized and doing this kind of multidisciplinary work, how do patients access it? Is it usually they have by primary care referral, or can they sort of refer themselves? And does insurance tend to cover these, or is it just depend upon your insurance and the clinic's kind of setup? How does that sort of all work in terms of patient access?
Yeah, it generally depends on the clinic and on patient's insurance. I did ask each of the PIs who I talked to what their intake process was. So in the story, in the section with the kind of profiles about each clinic, there's a link to their specific process. And I mentioned whether a referral is required or whether people can self-refer.
Okay. You've frozen there for a second.
In a couple of cases, also a positive COVID test might be required, which we know is not great for access for many reasons. But unfortunately, that does still seem to be a requirement in a few cases.
Right, I saw that. But I saw then others said, well, we don't require that. And in fact, we'll take, if you have other infection-related chronic conditions, we'll take you as well.
Yeah, so it depends a lot on the clinic, basically.
Okay. Betsy, thanks very much. I appreciate talking to you. And hold on a sec.